This is Health Matters, a podcast from Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're talking about back pain. There's nothing quite like back pain that leaves you lying on the floor, wondering what you could have possibly done to deserve this. Was it from helping your friend move, bending down to tie your shoe, someone looking at you the wrong way? Almost all back pain feels serious, but some cases are more serious than others. So, when can your back heal on its own? When should you see a doctor? And how do you make sure this doesn't keep happening? This episode, we're talking with Dr. Nick Consinello about what to do when back problems are a real pain. He's a pain medicine physician at Mayo Clinic in Rochester, Minnesota, where every day he helps people with back pain find relief. Dr. Consinello, thank you so much for being here today. Welcome to the show.
Thank you so much. It's my pleasure to be here today.
Well, we are excited to talk with you about the backbone of our health. That's right. We're talking about backs today. Your work centers around the evaluation and management of back pain. What do your patients normally say when they come to you? What's going on?
I work in the spine center and the pain clinic. So we see predominantly back and neck pain, a lot of pain that is spine derived and impacts the leg or arm when there's a pinched nerve. But I also see other pain conditions such as complex regional pain syndrome or chronic neuropathic pain. So a lot of patients come in and they are simply suffering. They've had back pain for a long time, and it just slowly but surely has eaten away at their ability to do activities and box them in their lives. And sometimes even sleep is impacted, and that's just the final straw.
Tell us, how common is back pain?
It's extremely common. It's the number one cause of disability in the United States and worldwide. And about 4 in every 10 adults in the United States has experienced back pain in the last 3 months. And it has a huge economic impact if you think of just the number of people affected and the days that they're missing from work and the amount of healthcare dollars that are spent helping these people. And as our population gets older, it's going to impact more people, as age is one of the risk factors. So I think we're going to see a lot more back pain over the next few decades.
What is it about aging that affects our backs?
So the main thing with age is that you start to get some arthritis or arthritis-type changes that occur in the spine. One of the main places is actually in the disc. And if we think about the disc that lies between the vertebrae of our spine, it's kind of like a jelly donut in that there's a gel substance in the center and a more fibrous or thicker, tougher outer ring to that. And that disc is really important. It provides stability and cushioning and some flexibility to our spine, but it undergoes changes as we get older. We lose some water content of that disc, and we start to get thinning of the disc. And some folks even get a little bit shorter as they get older from that. When that starts to occur, it starts to stress other spots and areas of the spine and can place you at higher risk for more arthritis changes, more pinching of the nerves due to decreased space for those nerves to travel through the spine. So there's a lot of changes that can occur, and it just tends to get worse as we get older.
Yeah, I've known people who, when they get back pain for the first time, are like, oh no, I'm getting old. But we know it's not just age. What else increases our risk?
So non-modifiable risk factors for spine conditions are age, gender. Females tend to get back pain more often. Caucasian people and those with incomes below the federal poverty level are all impacted more so than others. But there's other ones that people can modify or change. We know that smokers tend to have more disc changes and spine changes that can worsen over time and lead to more spine-related pain. Obesity also can certainly lead to higher levels of pain in the spine. We know that inactive folks, so people that are not getting enough physical activity or exercise, are also at risk.
Do we know why women or Caucasian folks are more likely to suffer from back pain?
I don't think we fully understand that. I think there's a little bit more understanding about some of the folks living below the poverty line. There's just less access to care. They may have higher risk jobs, such as manual labor, intensive jobs, and not being able to receive the proper nutrition and things to live a healthy lifestyle can impact your spine health overall and lead you to experience some more pain than other folks.
You mentioned that certain kinds of jobs can affect back health. What are some occupations where back pain is especially common?
The patients that I see who have jobs that they're in kind of awkward postures, nurses, for example, moving patients around, helping them, tend to be at more risk. Other folks that are laborers that are bent over, landscaping, doing a lot of heavy lifting and twisting, all of those jobs are placing you at a little bit more risk of developing back pain.
And even if we don't have that type of job, but maybe we have a lousy posture, does that also affect our back health?
I think you're right. We need to optimize our workplace environment. So proper height of the computer monitor, where the keyboard and the mouse are laid out, your desk chair and how you sit in that chair can all be optimized to help with your spine health.
I have to confess something. Sometimes I think I'm doing all the things right. I am getting my exercise every week. I don't smoke. I'm at the weight the doctor wants me to be at. But once in a while, I might just hurt my back by, this is so embarrassing. One time I hurt it just by reaching for a pen under my desk. Why does that kind of back pain happen when it seems like I'm doing everything else right?
That's $1 million question. I don't think we have the exact understanding to pinpoint why somebody that is bending over to put their socks on develops horrible low back pain, but they were able to shovel the whole driveway.
Yes. Oh my gosh. Familiar story. Yes.
So we don't fully understand that, but there is repetitive load to the spine. And I think it's the old straw that broke the camel's back kind of situation. One of our schedulers, she's been cutting down trees and all sorts of stuff at her hobby farm. And she's been doing that for months. And I think she was putting her shoe on or putting her sock on and she developed horrible back pain. So you're not alone.
From knocking down trees to putting on a sock, and it's the sock that gets
She's
you.
a tough woman, but it was just exactly the situation that you mentioned. I don't understand it. I'm not sure anybody does, but you can go from moving logs around and then you just bend over.
Back pain is incredibly common. 4 out of 10 people have experienced it in just the past 3 months. We know that age makes people more susceptible to back pain, both because of arthritis in the spine and the fact that our discs just get less juicy as we age. Similarly, poor posture or manual labor like twisting and lifting can put people at higher risk of back pain. So can smoking, a sedentary lifestyle, and conditions like obesity. But some things about back pain are still a mystery. We don't know why people assigned female at birth or Caucasian folks are more likely to develop back pain. We also don't know why back pain can be triggered by seemingly the smallest things, like picking something up off the floor or bending over to tie our shoes. But not all back pain is created equal. So let's find out when you should wait for it to heal on its own and when you should see your doctor. Let's dig deeper into diagnosing back pain. We know there are different types of back pain that can range in severity. How do you tell if back pain is run-of-the-mill or something more serious?
If we think about worrisome back pain versus just kind of run-of-the-mill benign back pain. Some of the symptoms that you can get make it more worrisome or concerning, and those are things like a history of cancer, unexplained weight loss, fever, a recent spinal procedure, weakness in the arms or legs, significant numbness or tingling, trouble controlling their bladder, or trouble urinating. Any of those should prompt a more urgent evaluation from a provider. Other non-worrisome or more benign types of things that can occur are people that develop these muscle strains. Often that is a condition where somebody has an acutely increased load on their back. They might have had to do some extra gardening or landscaping. They may have done some shoveling. And that day or that night or maybe the day after, they develop a really sore back that is often described as stiffness. They might have some cramping. A lot of patients can pinpoint, this is where it hurts, doctor, and you can feel just how tight it is. And those conditions often get better pretty quickly, and they can often weather the storm at home for a while and have improvement or resolution of their symptoms.
And the issues you connected to worrisome back pain, things like surgery, issues with controlling one's bladder, numbness, tingling, why is that worrisome?
So when you think about the spine, you got to think about the components. There's bones of the spine, the vertebrae, there's the disc, and then there's the spinal cord and the spinal nerves that are traveling through the spine. Certain conditions can impact the bones and the nerves. So a cancer that invades the bones of the spine will often lead to back pain, and that could be a presenting sign or symptom of that cancer. And so folks that are older and especially have a history of a cancer, we take that very seriously if they develop new onset back pain. If somebody develops some of those nerve symptoms that I mentioned, such as tingling, numbness, weakness in the leg, or trouble with the bladder, all of those could signify that there's some issue with the nerve function, and that could be related to the spine, whether that's a disc herniation or an infection of the spine that's compressing the spinal nerves. All of those would warrant further workup and fairly urgently.
So it sounds like in some cases, back pain is not just back pain, it's a litmus test for other diseases and bigger issues.
And not all back pain is from the spine. There's other things like kidney stones that can have referred back pain. So if it has those worrisome signs, you should seek evaluation sooner. If it's a back pain where you don't have one of those symptoms right away, but it's not improving with the treatments that you're doing at home or over time, or you're having stomach pain too, or you've had a history of kidney stones, I think those situations you should see a provider.
Now, let's talk about two big sources of back pain that I've heard about a lot, muscle strain and disc issues. Knowing the difference is obviously important for getting the proper treatment. So let's just break those down individually a little bit more. What would fall under the category of muscle strain?
Developing these sore, tired, cramping, low back discomforts that are occurring after some type of physical activity can represent a muscle strain. Fortunately, they often improve very quickly within days or a couple of weeks. And the pain is just located in the back. It might refer down into the buttocks a little bit, but it's generally not into the legs and certainly not associated with any type of nerve symptoms such as numbness, tingling, or weakness.
What about the herniated disc? Can I actually have a disc issue, for example, because I've lifted something in the wrong way?
Unfortunately, the answer is yes. Sometimes overdoing it, lifting and twisting is particularly hard on the spine. So lifting something like a suitcase can cause disc issues. If we think about the jelly donut that I described earlier as the disc between the vertebrae, a disc herniation is referring to when some of the jelly within the donut is coming out or escaping or herniating through that tougher outer part of that disc. And that could lead to compression or irritation of the spinal nerves that are traveling through the spine down to the arms or the legs. And so often, if somebody has developed a herniated disc, you'll know that by the pain that's into the legs, and often with some numbness and tingling and potentially weakness.
So this sounds much more serious. Is there a potential there for chronic disability when there are disc issues?
Absolutely. When we think about back pain, we have these things like muscle strains that tend to improve quickly. Herniated discs take a long time to improve. Fortunately, somewhere between 80 and 90% of patients who develop these will have substantial improvement over time, but it might take several months, if not a year. And with that numbness and tingling, potential weakness, all of those symptoms can lead to further disability and inhibit somebody's ability to work, to walk, or enjoy their hobbies and activities.
So herniated disc versus muscle strain, do they feel distinct? Can you tell by the symptoms which one you have?
So in muscle strains, the pain issue there is an irritated muscle that will kind of want to shut down. We call it pain inhibition. And so the muscle and your body will want to protect itself. And so when you get this pain that is occurring when you bend over or you twist or you reach for an item, then your body is telling you to take it easy. And so that's a potential for some chronic disability and or immobility, but it's much more common that folks have just a few days or a couple weeks of impacted activity, then they start feeling better. Unfortunately, with the disc herniations, that tends to be longer lasting. And so folks that have disc herniations often have that leg pain and numbness that I mentioned, but they can have that occur worse when bending forward or sitting too long. A lot of patients describe extreme pain when they're sneezing or coughing because they're increasing the pressure on their abdomen and spine, and that kind of puts more pressure to that herniated disc and leads to more nerve pain down the leg.
And if somebody gets either a herniated disc or muscle strain, is it more likely to happen to them again than the person who doesn't have it?
That's correct. There's a higher likelihood that somebody who has previously had a disc herniation or disc bulge, that they could experience another disc herniation in the future. Same is true with muscle strain or muscle type pain after an activity. If they don't make changes such as more exercise, strength training, and they continue to do these activities that overdo it essentially on their spine, then they're at risk to have a recurrent muscle strain.
So if someone out there is suffering from either muscle strain or a herniated disc, what steps would they take to get it diagnosed? Let's start with muscle strain first.
Largely, it's based on the history and the physical examination to diagnose muscle strain. There's not an X-ray that's going to point to a muscle strain. We often obtain X-rays for folks that have had several weeks or more of back pain just to rule out or exclude some other conditions like a spinal fracture or significant arthritis and that sort of thing.
And what about a herniated disc? How is that diagnosis going to be different?
So it's a little more nuanced. You can still get away with a history and physical examination for some patients to be able to diagnose or suspect a disc herniation, but really to confirm it, you need more imaging. So not just an X-ray, but you need to actually get a lumbar or a cervical spine MRI scan, and you can pinpoint if there's a nerve and disc issue at what area of the spine is it, what level is it, and how bad is it?
The spine is a major center of our neurological system. Does that mean you also are giving neurological tests?
So if we are concerned about the nerve function of a patient, let's say they have weakness, but there's not a completely clear reason on their imaging, then sometimes we get a study called an EMG. And EMG is electromyography, and this is something that we get to help measure or test the function or health of the nerves leaving the spine and feeding into the muscles, and it helps assess the health of those muscles. And we can pinpoint where exactly along that nerve leaving the spine to connecting to the actual muscle, there might be an issue. And that could be from a disc in the spine, or it could be somewhere else along that nerve pathway, such as an injury to the nerve in the leg.
So, how do you tell if your back pain is serious? If it's a muscle strain, you'll probably feel soreness or stiffness located in a specific spot on your back, and you might be able to connect it to an activity you did recently. Fortunately, muscle strains, though painful, tend to improve on their own with treatment at home. But if you notice tingling, numbness, weakness in your leg, or trouble with your bladder, those could be signs of a herniated disc or something more serious. The good news is the majority of herniated discs will get better on their own, though it may take months or even a full year. However, these symptoms are serious enough that if you have them, you should get checked out by a doctor regardless. Most of us know that hurting your back can hurt so much. So let's learn how to get that much needed relief. All right, let's talk about something more positive now. Let's talk about treatment, starting with muscle strain. What are the treatments for muscle strain?
So for treatments in muscle strain, it's pretty simple. We consider the RICE, rest, ice, compression, evaluation. That's the typical acute injury treatment, but it doesn't work quite as well for muscle strains. Ice can be helpful, but often it's relative rest. So I think what we need to do here is to back off our activity levels, but we don't recommend that patients spend most of the day laying around in bed. We want them to be a little bit active. And so we don't want them to be shoveling or lifting heavy items, but a gentle walk, some stretching can be very, very helpful and help lessen the pain and help it go away faster.
What about over-the-counter pain relievers?
Tylenol is probably the safest and easiest first-line medication for over-the-counter, but the non-steroidal anti-inflammatory medications such as naproxen, which is trade name Aleve, ibuprofen or Advil, can be very beneficial, but you need to be mindful of your other medical conditions such as stomach or kidney issues before taking these medications. Other medications and things that you could try at home would include topical creams and lidocaine patches. Folks that are having pain that is beyond that controlled by these medications and creams, I recommend that they think about massage therapy, chiropractic care, maybe acupuncture. All of these treatments can be helpful for this acute muscle strain or low back pain.
And what about treatment options for herniated discs?
That's going to be a little bit more complex. So you can trial just about everything that I previously mentioned for the muscle strain, but it tends to not be as responsive to these medications. So things that we can do or we can help with are physical therapy. So arranging physical therapy to try to help maintain some of that strength is important also in the core, but in the legs, and do that in a way that doesn't cause further compression of that nerve. As with muscle strain, relative rest is important. But if somebody is having a lot of pain and it seems like it's consistent with a herniated disc, we might prescribe non-opioid medication specifically to treat nerve pain. And to take it a step further, sometimes patients would benefit from an injection.
Like a steroid injection?
Yes, a steroid injection. So if we can pinpoint where the disc is herniated and what spinal nerve it's affecting, we can place a needle in the epidural space that's right around those nerves and put steroid there to decrease some of that inflammation and irritation upon that nerve.
And when does surgery become an option?
So there's several indications for spine surgery for a disc herniation. One of them is that there's weakness that's at least moderate or severe at the start. So if somebody comes in, they can't lift up their foot, then that patient needs to be seen by a surgeon. But if there's pain that's intractable to treatments, then we might recommend that they see a spine surgeon. And other times, there's just so much pain and it's such a major disc herniation that we might recommend that they see a surgeon sooner than later.
And after surgery, how long is the recovery time and what does the recovery involve?
I'm not a spine surgeon, but what I do know is it depends on the spine surgery. So what I tell patients, even if they're apprehensive about surgery, is to just meet with the surgeon, understand what they're proposing, and go from there. That education that they can provide is very valuable information, and it doesn't mean that every patient is going to undergo surgery.
Let's talk about prevention. While a lot of people out there are trying their best to just live healthy lives, are there any specific things that maybe we should be doing to prevent injury or prevent future injury?
The most important things that they can do to prevent spine conditions is to maintain a healthy body weight and get some frequent exercise and movement. Patients that are getting 150 minutes or so of exercise a week, which is the minimum recommended guideline, are less likely to develop back pain. Just move more, exercise more, include some strength training, and they can decrease the risk of developing spine pain in the future. On top of that, being aware of activities that could place your spine at risk, lifting with your back instead of your legs, heavy or repetitive lifting, twisting activities, and poor posture, whether that's at work or home, can all place you at risk. And I think education regarding that posture and lifting mechanics and things can make a big impact.
What do you mean by education?
There's patient education that's available at Mayo Clinic. Often meeting with a physical or occupational therapist can be very helpful. They can go through some of the lifting and motions to get the job done, but in a more spine healthy type of way. Another one is that a lot of workplaces have ergonomic experts, and these are often occupational therapists. They'll help you with proper computer monitor setup so that you're at less risk for a workplace injury.
And last but not least, how can people who've experienced back pain best set themselves up for success both during and after treatment?
I'd say the patients that come back the happiest are the ones that have made some lifestyle changes in combination with our treatment. So I send patients to physical therapists, to chiropractors, acupuncture, surgeons if it's necessary. We do injections, we do spinal stimulators, and they can combine that pain relief with some positive lifestyle changes such as weight loss or increased exercise. They can be in a much better spot and they come back quite happy.
Well, Dr. Canzanello, this has been such an illuminating conversation. And now I don't feel so stupid about hurting my back picking up a pen. Thank you.
It's been my pleasure. Thank you so much for having me.
If you hurt your back, one of the most important things is relative rest. That doesn't mean lie in bed all day, just don't overexert your strained muscles. Instead, try something like light exercise and stretching. Over-the-counter pain medications and creams are also perfectly good solutions to try. If those aren't cutting it or your injury is more serious, your doctor can provide you with a physical therapy referral, prescription non-opioid pain medications, or even a steroid injection. In cases where your function is severely compromised, they may even refer you to surgery. But to keep your back healthy so you don't get to that point, make sure you're getting the recommended amount of exercise to stay healthy. You may also want to learn proper lifting techniques, work on improving your posture, and make sure your workstation setup is ergonomically aligned. Back pain may be common, but living in pain doesn't have to be. Take care of your body, and it'll have your back. Okay, that's all for this episode. But if you've got a question, a topic suggestion, or a follow-up question about this episode, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more Health Matters episodes and resources, head to mayoclinic.org/Health Matters. And if you found this show helpful, please subscribe and make sure to rate and review us in your podcast app. It really does help others find the show. Thanks for listening, and until next time, take care and stay healthy.